Let's talk about creatine dosing. I thought we were going to get to it in the last video, but I just don't talk fast enough. When we think about creatine dosing, first let's remember how much our bodies produce. Our bodies produce about 1 to 2 grams per day, and then we can intake somewhere around 1 to 3 grams in our diet, once again through animal products. When you look at the studies, most studies typically use around 5 grams per day. So that's a lot of supplemental creatine when you think about the fact that we're only producing 1 to 2 grams. Now, the studies that are being done right now in bone health and cognition have been using higher doses, 8 grams, 10 grams, sometimes even up to 20 grams. And there have been studies in bone health showing that a lower dose of creatine, like 2 to 3 grams per day, isn't effective. So should you be taking a higher dose? Potentially, if you're aiming for the cognitive impact, especially under periods of acute stress like sleep deprivation or jet lag, or if your goal is more the bone health than the muscle health. Now, some people will not tolerate that high dose all at once, which is why I typically recommend if you're taking more than 5 grams to break it up into many doses throughout the day. Some studies have used a loading dose where you take 20 grams for 7 days, and then after that period, go down to your maintenance dose, which might be 5 grams. That was really historical, and many studies are not doing that anymore. But if your goal is to saturate your muscles as soon as you can with creatine, then a loading dose of about 20 grams for 7 days might be a good option. Just be careful, this might cause GI upset. Next, let's talk about what creatine should you take. Creatine monohydrate is the gold standard. It is what all the studies that have been done on, and there's really no evidence to support that any of the other formulations are more efficacious. Now, you can get microionized forms, which dissolve easier in water, and for some people result in less GI distress, so that might be a good option, but really go with monohydrate. It's the OG. Are there any contraindications or people in whom should not take creatine? There have been studies showing that it is safe in children, so I actually do give my own kids creatine. There are limited studies for pregnant patients, so I would definitely say if you're pregnant, consult your healthcare provider. And in patients with kidney disease, I would also consult your healthcare provider. But we will talk about myths regarding kidney disease in our next video.